everyone. Welcome and thank you for attending our VA Mobile Health Discussion Series webinar. My name is Denise Kennedy and I'm going to run through a few brief reminders before we begin the discussion. Your phone lines are muted. We will be taking questions throughout the presentation through the chat feature. If you are experiencing any technical difficulties, please use the chat function that is available to you at the bottom left of your screen. To respect everyone's schedules, we'll keep this moving so the session ends on time. Today, we welcome Dr. Eric Spahn, Program Analyst for VHA Pharmacy Benefits Management, and Damian Sharp, Manager for MDL Technologies. Dr. Spahn will kick us off with an introduction of the Ask a Pharmacist app. As I mentioned before, if you have any questions for our presenters, please use the chat feature. We will stop the presentation intermittently to answer those questions. If we don't get to your question, we'll send out an email following this webinar with any relevant answers. To download the presentation, please click on the paper clip at the top right of the chat screen. And with that, I'll turn this over to our presenter. Dr. Spahn, over to you.
Hi, thank you, and thank you all for attending. So this is the first presentation for this series for Ask a Pharmacist mobile app. It's a project that we're happy to announce has gone into production, I believe, week before last, and we're currently working on marketing tools to send out to some pilot sites for testing so that we can get those out to the all the sites to introduce this app and its features and how it can benefit not just pharmacy, but pharmacy users, the veterans, but also maybe even the staff, help with some of their workflow processes. And so this is a project we've initially submitted online from our
Lois is again.
Hi, everyone. Thank you for sticking with us. It looks like we had a phone glitch and lost audio. We are going to take a 3-minute break here and let some people sign back on and get resituated. Just give us a second. And again, thanks for being with us, and we'll be sure to end on time.
Okay. And please interrupt me if it gets cuts in and out. It seems like it's a little bit choppy, even when it's connected.
Absolutely.
Are you hearing me okay now?
Yeah, you sound really clear now. Thank you for that.
Okay, great. And I meant to tell you, too, while we're going through this presentation, this is in production, so you can even do a Google search right now for Ask a Pharmacist VA app, and you can actually go to the web page and launch the app. It's not something you have to download. It's, of course, web-based, so you can just launch the app and be able to kind of follow along as we're presenting slides. So, again, I don't know where I cut out previously, but this project initiated with My Healthy Vet, and it merged over to the mobile platform when the mobile came along. So we're excited to offer this desktop mobile version that can be used from any device as long as the browser is supported. I think the technical folks could probably mention which ones they support as sort of a mobile feature, but essentially Ask a Pharmacist app is a place for veterans to go and find as much pharmacy information that we can provide as far as VA-specific pharmacy information, stuff on My Healthy Vet, which is sort of scattered through the site, putting it all in one area, and also just educating veterans on, resources that are available, even some external resources that we think would help veterans, look at their medication list and determine what medication information is important to share and learn about, and how to read a label and how to identify medications, just anything that they ask pharmacists on a daily basis, not just pharmacists but pharmacy technicians. And then connecting the great feature of secure messaging in My Healthy Vet, since we've been working on a project for Ask a Pharmacist and secure messaging ever since about 2009, and kind of merging the setup and secure messaging with this mobile app. And so it's a really unique app that connects users not only to resources but also to secure messaging and helping sites get that set up for the communication. So we can go to the next slide. I think, Alan, are you driving? Okay. So from the Launchpad, if you haven't seen the Launchpad before, this is the VA mobile Launchpad where the current apps are being stored. So you can see Ask a Pharmacist is added to the lower right portion of this, has a small introduction to the app, and this is where if you were visiting the Launchpad, you could go to. Now, if you do the Google search like we mentioned before, you could actually launch it after going through the end-user licensing agreement and go straight to the app as a standalone app, but it is available on the Launchpad. Next slide. So here's the landing page for Ask a Pharmacist, and so we started with requirements. We had a big group, and I see some of you on the call who've actually participated in the requirements for Ask a Pharmacist. What we did with our requirements is we asked for essentially everything under the hood as far as generating requirements, and then with any development, you have to consider your scope, especially for a version 1 release of an app. That way you can get something out the door and you're not restricted from funding and timelines and resources that prevent these sort of features from coming out. So this is essentially version 1 based on the requirements we had and the funding and the scope of the app. So we have these 5 main categories, prescription refill and pharmacy services, and these are specific to My Healthy Vet. Also some trusted medication resources that are both internal and external to the VA. And also vetted by pharmacy subject matter experts, some pill and bottle information, and then sort of about VA pharmacies, which is generally, what are the standard operating procedures of a VA pharmacy and what to expect when you use a VA pharmacy. And then, of course, a link to secure messaging. You can't have an Ask a Pharmacist app without some sort of link to how to communicate with veterans using the secure messaging feature. So we're going to take a walk through some of these screenshots to go over some of the features. Again, this is the home page, and you can access this page by selecting home no matter where you are in the app. Next slide, please. Okay, so you can see from the above the top here, we actually came from the prescription refill pharmacy service button on the home page, and this is a list of different things we have, such as prescription history from My Healthy Vet, RX Refill, the RX Refill Guide, track my medications, and frequently asked questions on My Healthy Vet, as well as information from the Veterans Health Library, such as the medical library. Now, a lot of these services require you to authenticate. The one thing the first version of this app does not do is require authentication. So anyone using Ask a Pharmacist or going to Ask a Pharmacist can use these links. Once you get to My Healthy Vet, you would have to authenticate from that point in order to actually go into RX Refill or to track your medications. And that's because it's the first version of the app, and we hope to incorporate, authentication once additional enhancements are done with the mobile features in general. But to get it out there first is just links to My Healthy Vet and these specific modules that are already available. Next slide. Okay, so if we were on that page that we saw before and we selected Track My Medications, and if you notice, a lot of these links have descriptions underneath each of them. Now, the descriptions are there to help the veteran or end user or caregiver to see where they're sort of headed when they select one of these links. That way, it gives them an insight before they actually have to exit the app and go to an external site. So here you have prescription tracker FAQs. You also have links to UPS My Choice and USPS. The reason we included those two links is the tracking feature on My Healthy Vet is tracking using the U.S. Postal Service, and notifications can be set on that site. But some stuff is sent locally and cannot be tracked from the My Healthy Vet tracking feature. So for those local sites, those local fields, you want to get notification, you can go to the UPS My Choice and set up notifications from there. That way you can be notified no matter whether it's sent from a local VA facility or maybe from a mail order facility. It helps the users set those accounts up. Next slide. This is a great feature. I think will be very popular with the veterans. This is a pill and bottle information. And we didn't just take a standard label out there off the internet. This is actually the patient safety, patient-centric label that was created by Patient Safety Office. So it includes the basically annotations to the label to show where your directions are on your medication, where your name would be, where the prescription is, how to read a label, because many times veterans are looking for this information when they're trying to talk to about their medications. They just don't know where to look on the label, and this helps to kind of point that out, and then show that there's additional information for safety tips. Next slide. Now, under the Trusted Medication Resources tab, you can see there's a variety of links here. Many of these are going to FDA websites. There's also a pill identification link that you can see on multiple tabs throughout this app. And there's a disposal, as far as medication disposal, that links you to the PBM site about, that's a popular feature that we have currently with disposing medications. How to properly administer medication, that's the A Safe Med site created by ASHP. Is a very popular pharmacy site that helps them to, how to use an inhaler, how to do an injection, those sort of things. There's a lot of good information on drug interactions too. We get a lot of requests on My Healthy Vet to provide a search tool for drug interactions, and this app actually takes users to drugs.com to utilize that sort of feature, since we don't have that currently on My Healthy Vet. So this app really tries to pull in pharmacy resources from My Healthy Vet. It also tries to pull in some resources that are not available that veterans have been asking for, and the sources that we provide are vetted. So it's better than them going to Google and utilizing some sort of website that maybe is not very well trusted. These are resources that we've vetted through our subject matter experts that work on this app. Next slide, please. So if you select the consumer drug herbal supplement information, it takes you to another little further down the breadcrumb trail where you can get latest safety articles, information about medications from FDA.gov, safety practices, even reporting medication errors. If there's a site for it on FDA.gov and we think it's useful for a patient, we put it in here. One of the great features of any sort of reporting they do on FDA.gov is an alert. I don't know if we have a screenshot of that, but when you select a link and it takes you to an external site to report something like a med error, it notifies the user that this information is not being stored in the electronic health record, and anything they report needs to also be communicated to their healthcare team. So that's a safety feature we have on the app, so that they understand that they need to also report to their team, so that can be documented. And it's a hard stop, so they can't actually go to the site until they acknowledge that. Next screen. So this is one of the popular features I think will be for the app as well. It's the Veterans Affairs National Formulary. And when you say formulary, many veterans don't know what that is. So we've provided some questions and answers, frequently asked questions to what a formulary is, what's the purpose of it, what's listed in the National Formulary. You notice on question 5 there's an actual hyperlink there to pbm.gov, where there's a new search tool that was just created where you can search the National Formulary search engine that was developed by PBM. And I think this will be a great source for those VA choice patients to present to their provider with this app when the provider is trying to determine what they can prescribe, since non-VA providers prescribing to VA patients are not as familiar with the formulary. And so this resource will allow those veterans to share that with their provider and be able to search through that before they write a script and bring it back to the VA. Next slide. Here's an example of that hyperlink. It takes you to the Pharmacy Benefits Management page for the formulary search, so that you can see there's a search box. It's a great source, newly developed. I think we're going to be promoting this on My Healthy Vet soon as well. And it actually gives you formulary alternatives if you do search for a med, and it'll tell you not only is it formulary or not, but what alternatives you could prescribe as far as the drug class goes. There would be an alternative, since they're bringing it back to the VA, and allow them to not only see that and get better approval rates, with whatever they're bringing from the non-VA healthcare system. Next slide. Okay, this is a general, this is actually an article we have on My Healthy Vet. We actually helped draft the article on how VA pharmacies operate. It's a summary from our outpatient pharmacy handbook on how prescriptions are requested, how they're put into the system, what to expect as far as how long it'll take to mail in the system. If you're going to submit a refill, how long they need to submit that in advance so that they get the medicine on time before they run out. What sort of day supply we use with medications. It even has a link to the FDA to define what DEA controlled substance schedules are. We get that a lot of those questions come through for pharmacy in general. So it's nice to provide these answers to general questions that come through. Can actually save on quite a bit of the call traffic when these questions are answered for the veterans on the app. But we always want to default to allow them to use secure messaging if needed. Next slide. So that sort of summarizes. Now, we didn't show every screenshot of the app, just some of the main features. One of the ones we didn't show was actually a pill identification screen that the National Library of Medicine used to allow veterans to search through the image library that the VA actually created, and the National Library of Medicine has a search tool for that. So this will help veterans actually identify medications they're taking using the images and the imprints. So we left that off because of just had the missing screenshot. But any additional questions, I'd be happy to answer at this time.
Yeah, thanks, Dr. Spahn. We have 4 questions, and I see there's some others chiming in. But the first question is from Donald, and he wants to know who will be available to assist patients with installing and using the app?
You're kind of cutting out. Let me see. Is this one of the IM questions here?
Yes. Hear me now?
I can hear you now.
Okay. The question is, who will be available to assist patients with installing and using the app?
Let's see. I'm going to have to read the question up here because I'm still having trouble hearing you. Let's see.
I think the question is, this is Damien, Dr. Spahn, who will be able to assist vets with installing and using the application?
Okay, I see up there. So who will be able to help? I assume that there's a lot of this effort, just like with the My Healthy Vet effort, will be the My Healthy Vet coordinators. You know, it'll be promoted on the My Healthy Vet site, so that's something that will be shown on My Healthy Vet, as well as the marketing materials that are being sent out. They're going to be going through a lot of the dispensing packages from pharmacies, so they'll get an extra pamphlet in the package they receive in the mail, helping them to understand how to not only download, you know, access the app through the Launchpad, but also provide them with information on what the app is. So as far as that would be more of a just informational. But My Healthy Vet coordinators, we are also sending training material for My Healthy Vet coordinators. As you can see, there's a question here about this app assumes each facility has a secure messages team with pharmacy. What it does, it actually sends a message directed to the healthcare team. It would be most beneficial if they have a triage group for pharmacy at the location that the veteran is using, and we've had marketing material on not only how to set that up, but even use some nomenclature that will help with keeping those triage groups consistent and helping set those triage groups up so they work most efficiently, because that's been our effort since 2009, is just the setting up of triage groups called Ask a Pharmacist. And all that work is, as we'll show you in some slides later, that will actually benefit the use of this app.
Great. And can you hear me, Dr. Spahn?
Yes.
Okay. The next question is any of the info able to print and use by providers for patient education?
Okay, I guess you kind of cut out again. I guess if you tell me the name of the person asking the question, if it's in the IM, I can try to look it up here.
Kathleen asked the question early on, and she wanted to know if any of the information is able to print or use by providers.
Oh, yes, definitely. I mean, this is a feature. Now, as far as being able to print from a mobile app, it's the same ability as you have now. So as far as sending the URL through an email device from the app, or trying to do a print screen, but you know, this can be used as a desktop version. So if you're using it as a desktop version, you'll be able to, you know, print it just as you would any web page. And so all the resources that we link you to, if they have printable outputs, you could utilize, you know, this as well. It's really a resource of links to provide that are pharmacy related. So when you go to that external site, as long as you can print from there, you could print for education.
And we're going to try this one more time. Diana asks, is there any pull-in from the Veteran Health Library, either as part of My Healthy Vet or directly?
Let's see, is there any pull-in from the Veterans Health Library, either as part of My Healthy Vet or directly? So we definitely link under the Trusted Medication Resources to both components of the Veteran Health Library, which is the Medlines Plus and the library itself. So we have, you know, a link to those resources. Again, this is the version 1 of this application, and it's not authenticating the patient, so it's not displaying a med list unless they actually go to My Healthy Vet and authenticate from there. And since that's not a functionality of My Healthy Vet to link the med to the health library, then we of course, this can't improve on that. It will send you to the Veteran Health Library, though, directly, so you'll be able to access that. So they won't have to search for that link. It's basically directing them where to go to look up drug information using the Veteran Health Library and providing the link.
Excellent. And can you hear me any better, Dr. Spahn?
Yeah, that's better.
We switched phones here. We're very fluid today with all this technology transfer. Diana asks, is there any plans to encourage pharmacy to develop an SM team just for pharmacy? Secure message team just for pharmacy.
Yes, exactly. There's a lot of efforts out there. In fact, there's a draft currently, I believe, for any sort of direct patient care services to establish a secure messaging triage group for that service. So this is essentially getting pharmacy ahead of the game, in that other than our encouragement as well to say, you know, if a veteran is using this app, it would be encouraging to have a secure messaging team set up in pharmacies so that if they do go to send a secure message and they authenticate themselves on My Healthy Vet, then when they go to send a message, they can actually drop down and see something pharmacy related. And it would be even better if that team is called Ask a Pharmacist and maybe include the site name, such as Ask a Pharmacist Interim or Ask a Pharmacist Portland, so that the veteran using multiple sites will be able to tell which center they're sending the message to. So it definitely is encouraged, and we are actually working on marketing materials that are going through the pilot sites to provide that sort of encouragement and set up instructions, and not only set up instructions, but also sort of workflow considerations when it comes to sending messages to a triage group, which all that is current practice. This basically will be kind of reminding sites on how to best utilize secure messaging, and this app will basically just be promoting the use of secure messaging even more than it is now, because we're providing a link there.
Great, thank you. And there's a lot of discussion on the chat around this being a web app versus a native app. Maybe a little bit of a misunderstanding here that it's not an app that you download through one of the Apple Store or the Google Play. Can you talk a little bit about the technology side of the app?
Yeah, this is a web-based mobile application, so there won't be any downloading of an app. It'll be launching an app just like you're going to a website. There'll be an end-user license agreement once you select the launch, either from the launch pad, or if you're already in there, you'll just go straight to the app. But there won't be an app on your phone that you'll see that you click on. It'll be a launch pad. And so this could be used on a desktop. It could be used on a tablet, on an iPhone, on an Android. As long as the browser is supported, they can any of those devices. But it won't be, as far as downloading, you won't have any issues, which, you know, some folks have issues downloading apps. I think going this route as far as mobile apps go is a little bit less complicated when you have to, you know, utilize those sign-ons and passwords for mobile apps.
It is also, this is Damien, it's also accessible through the VA App Store. Again, that's going to the URL for the VA App Store, searching for the VA App Store. It's accessible there. Also, training materials on that site. Once you click on Ask a Pharmacist to get information on there. But like Dr. Spahn says, this is not a mobile app in the true sense of a mobile app. This is a web app. So it will not be on the Play Store or in the Apple Store.
Excellent, thank you. And I know you have some additional slides for your presentation. I have one last question for you, and then you can jump right in. Regina asks, will medication copay changes be available for the veterans to see?
I'm sorry. Let's see. I'm switching to a handset. I think it was actually my speaker that was cutting out. Let's see. You said Regina?
Yes. She wanted to know, will medication copay changes be available for the veterans to see?
Well, that's going to be something that would require authentication to see. Now, this does link veterans to pbm.gov, so they can see any updates on information to copay changes there if they search through that site. And that copay change occurred actually after we'd already established requirements for this application. It would have to be, if we want to provide a link to that, just general information on that, it would have to be an enhancement for the next version, which we'd love to incorporate. But currently there's no link directly to that or any information, because as I mentioned, that was something that happened after we already gathered requirements and were in development that we couldn't just add on later.
Excellent. And I know that there's a few other questions popping in, but we think we'll let you continue on with the presentation and come to this after you're done with your slides.
Sure. So we talked a lot about secure messaging, and I'm going to go into secure messaging because although it's not something you have to have to utilize this, it's nice to have if you're promoting Ask a Pharmacist and essentially a new way to communicate with pharmacy versus a phone call. And as you can imagine, there's a lot of phone calls where we even have call centers to handle many calls coming through the VA pharmacies. But currently, to send a secure message to a pharmacy, you have to know the name of the pharmacy staff, or you have to send it to primary care, and they have to triage it to the pharmacy staff and have them reply back to you. So this essentially, by creating a triage group called Ask a Pharmacist, gives that contact name that a veteran can use, and if that's available, they know this is going to pharmacy. They don't have to know who exactly it goes to. And plus, it also allows the triage setup, which means you can set it to where messages coming through the Ask a Pharmacist group, the first person to see it is the triage staff, and if they can answer the question, they can answer it. So that could be a pharmacy technician. It doesn't interfere with the pharmacist working with patients directly. For those that need pharmacist attention, they can be reassigned, and these messages have a 3-day response, as secure messaging does. But it also allows for documentation of that conversation, and you don't have to listen to the voicemails and go back through the conversation when you call the patient back. It has it in black and white and documentation, and there's actually some work, if it's not out already, on workload capture for these conversations. So a lot of great features with secure messaging that are just external to this app, but make this app even more useful. And just one more thing before we actually go into the statistics on secure messaging in pharmacy, it's really a unique way of taking a mobile app and connecting to electronically to a messaging system in which the user of the app is likely to know or have worked with the person responding on the other end. Many of these Ask a Pharmacist things are available on other sites, other pharmacies, maybe major retail pharmacies online, but you don't know the person you're sending the message to. VA is unique in that the staff answering these questions are local to that medical center or maybe that local CBOC, and so if a patient's submitting a question, they're likely to have worked with or know the staff, and the staff know their profile very well because they're processing that patient's prescriptions. So it's very unique to use a national tool for local implementation, and that's one of the things we've promoted for secure messaging throughout the years. So if you go to the next slide, we'll just talk about that feature and how it can improve the use of this app. So when you select the button, you actually just go to the secure messaging homepage, and here a patient would have to authenticate. There is work being developed that's creating a secure messaging mobile app, and once that functionality is available, if we have the funds for additional versions of this app, we can actually link to the secure messaging mobile app so that we can provide a better usability for the user of the app. They don't have to go to My Healthy Vet. They can use the mobile version. The next page. So how is pharmacy utilizing secure messaging? So right now, I think this report is maybe a month old, but 21 VISNs have a triage group containing the term pharm. 15 of those have a triage group containing Ask and Pharm. And so this is a search tool that I use to use SQL query into the central data warehouse to determine utilization of secure messaging triage groups using these search terms. So there's 108 primary stations with the group containing Pharm, and of those 44 are Ask and Pharm as far as the way that the data is coming back. Next slide, please. Okay, so of the 108 primary stations, now these are primary stations, which means the station that's primary is the main VA medical center, so there could be multiple CBOCs, outpatient clinics that come off that primary station, but this is a search that we're using specific to those stations and secure messaging. We have, of these primary stations, we have 522 secure messaging groups that contain Pharm, and so when you think about that, you try to think, okay, what sort of scope are these triage groups being used for? And after you actually look through all 522, you find about 266 for general pharmacy services. Now, of those general pharmacy services, there's an additional 67 for Ask a Pharmacist, which is really a general pharmacy inquiry. It's not very clinically specific. It's more for general pharmacy questions. But those actually have the term Ask a Pharmacist. And so the others are more clinically based for either PACT or HPPC or even clinical specialty services like anti-coag or lipid management. And on the next slide, I'll kind of break it down to you how this this site utilization can be achieved. Next slide. Okay, so here's the same information, but more of a percentage, a little pie graph for you. So as we can see, a majority of the secure messaging for pharmacy is for general pharmacy purposes. That's the 51%. We have also 13% actually have the term Ask a Pharmacist. So based on our communication to the field, we can see that 13% have adopted the nomenclature we're suggesting for Ask a Pharmacist, and 51% they haven't adopted the nomenclature, but they are using it for the same purpose, which is pharmacy, general pharmacy, and all the others is specialty care and PACT and HPPC. So on the next slide, if you think about that, you take out the specialty care, you can see that a total of 64% of secure message triage groups are for general pharmacy purposes. And if we educate the sites to switch the names of their general pharmacies to Ask a Pharmacist, you could see that it would be the majority of messaging, and that's because this is for those general questions such as, you know, I'm tracking a med, I can't find it on the MyHealthyVet, or can you tell me when it's going to be here, or how many refills do I have left, or this drug looks different than what I've been taking. You know, those general things that come through the phone system are coming through the secure messaging system. So you can see it's a majority of the usage of secure messaging. Next slide, please. Now this basically breaks down, you know, of the percentage of specialty clinics. You know, what are specialty clinics being used for? So anti-coag is a heavy user of secure messaging triage groups. Diabetes, oncology are towards the lower end, and then you have a kind of a combination of women's health and endo as the other majority. But anticoagulation is highly used for this, and this is just a subset of the specialty groups to give you an idea of how this is being used. Next slide. So as we mentioned earlier, marketing materials are already on the website or on the web for Ask a Pharmacist. They have a user manual, a quick start guide. There's a slideshow and FAQs, and even some feedback that veterans are able to give feedback on the app itself. And I think Product Effectiveness is actually reviewing that since we just released the app. And so you can actually go to the site. You can, once you're at the site and read through these guides, you can actually launch to the app from there. But it's some really good information to get started on learning about the app. Next slide. Okay, so marketing sites. Now what this is, you know, this is apps in production, but what we're doing is drafting some marketing materials. Boston, Portland, and Little Rock, Arkansas have all offered to test our materials for dispersion at these sites over the next few weeks, and they'll be inserting them in pharmacy packages. They'll be posting things at the site. They'll be communicating a lot of this information, and once they've determined that the information they're dispensing is efficiently working, is getting good feedback, then we'll start sending the same materials out to all the sites to start incorporating, just to let veterans and caregivers know this app is out there and how to what it's about and how to get access to it, as well as the internal marketing with the secure messaging. Next slide. Okay, so this is the next question slide. So some of the questions we had earlier may have been covered by the material I just went over, but if there's additional questions, we can go ahead and walk through those now.
So there is some conversation on the chat and a couple of things we want to address. One, in our follow-up, we'll get some technology specifications for those of you asking what operating systems the Launchpad supports. We don't have that, but we are gathering that as we speak. So if you didn't get your question answered there, we will get back to you. Also, there's been some conversation about the downloading of the app on the phone and some concern from the some of the MyHealthyVet coordinators about doing that. I think Alan here wanted to chime in and see if he can help with that question as well. Alan?
So this step is a web app, and that's been explained by Dr. Spahn a little bit. So it functions much like a website, and what the user would be doing is actually browsing to the web application. browsing to the web application rather than actually downloading more traditionally like a standalone native web app that you would download from the Apple App Store or Google Play App Store.
Excellent. Thanks, Alan. And then there is a question from Diana who wants to know if the marketing materials have been evaluated for health literacy.
We're just in the beginning stages of developing them, and we will go through the typical process of vetting them through various different organizations, but we can definitely make sure that health literacy is on the list. We typically do plain language. We run materials by 508 and also run them by human factors as well. So, but we can add health literacy to that as well.
Excellent. And I just want to give one more minute as I see a couple of people typing. So I'm watching that. We'll just stay on the line for one more second. Lots of people thanking you, Dr. Spahn, for the useful information. If for some reason we missed your question in this Q&A, we will go back through it. We have been having some various technology challenges. Regina has asked Dr. Spahn, is each local VA is responsible for manning the app?
So what we have as part of that is the setup for secure messaging, and it's the current functionality. You know, this app isn't changing that. But if a site decides to create Ask a Pharmacist triage group for their veterans, the initial approach is to have one for the primary station. And if the patient sending the message is part of any CBOC or outpatient clinic that is attached to that primary station, you can create additional Ask a Pharmacist groups for that station. So if you had, you know, like I came from Fayetteville, Arkansas, that would be the main primary station is Ask a Pharmacist, Fayetteville, Arkansas. There's CBOCs for Harrison, so you could also create one for Ask a Pharmacist Harrison. And any messages coming into that main primary station can be reassigned to the CBOC where the patient actually goes to see, you know, either the primary care doctor or even a pharmacist if they're there. And after that assignment is made, that alerts the mouth-to-vet coordinator to add that patient to that group. So initially, it would be the primary station's responsibility to handle these questions, but as they reassign them to different different CBOC or different outpatient clinics under that main station, those patients will then be reassigned to those groups as well. So it would be the responsibility of the staff to do the initial setup, and as they sort of reassign their patients to the appropriate clinic they see, that would be a responsibility. One of the things that has to do with this too is there are pharmacy care centers under the Health Resource Center that man phone calls for sites, and they have a memorandum of understanding and get actually reimbursement for, you know, answering calls from the sites because the call volume is so extreme. It would be a constant interruption at the site. So we cannot, with the current understanding between the site and that center, they would have to actually create a new MOU if they want to start reimbursing them for answering any questions coming through secure messaging, since that's a different form of communication. The other alternative is to just continue to use that call center for calls and the site establish the secure messaging. Again, this is a triage group. It's not an email. So the only way, if you set it up correctly, and we're providing the guidance on that in the marketing materials, is that the only time you get a message in your inbox if it's been assigned specifically to you. And that's the responsibility of the triage staff. So if you have messages coming in to Ask a Pharmacist at the primary station and the triage staff reassigns it to a pharmacist, then you will see a notification in your inbox to go log into secure messaging and respond. If not, the triage staff will be able to answer the question. And we've seen majority of the time these general pharmacy questions can be answered by the triage staff, and which is usually a pharmacy technician who's also working calls. And we found that by setting this up, your call volume decreases quite a bit. There's different sites have different statistics. I'm sure the best practices could share those, but in general, you will see a reduced phone call volume because these users who are savvy with secure messaging, they would prefer to send it through that and able to actually document their request. So that's sort of when it comes to manning it, how that sort of setup would occur.
Excellent. And a few other questions that have come in. One is, my facility won't use secure messaging because they don't have the manpower or time needed. Can this be nationally mandated to implement Ask a Pharmacist as a secure messaging team?
Okay, so the two things. Number one is, a veteran's trying to contact you. They're going to attempt a secure message, or they're going to attempt a phone call, or just show up in person. So having the manpower needed, if you utilize a call center, yeah, it might increase some workload with messages coming in since you didn't have that before. We hope that many of these messages are replacing phone calls that are coming through, so it will actually reduce the time needed and the ability to respond within 3 days versus immediately having to go through all the voicemails and answer all the calls and then go back to the story. It takes much more time than a secure message. And even trying to get to the point of what the question is sometimes takes a lot of calls back and forth. So we're hoping this utilizing secure messaging helps that. Now the mandate of secure messaging goes back to discussions on a draft that triage groups and secure messaging be created for any line of service that works directly with patients. Because essentially we have this communication device. And if you have a service, just like you have a number for that service that you show on your web page, you would also think you would need a contact and secure messaging for that service as well. And so that's essentially what this is doing, is adding another line of communication for the veteran to the pharmacy, and not just the veteran to the pharmacy, but also the primary care team to the pharmacy, because general questions don't just come from veterans, they come from nurses, providers. And there's a very high clinical impact to secure messaging with appointments and such, but there's also a high need for just general questions to come through. And even some sites even add administrators on there for the administrative questions, so that if a general pharmacist gets it, they can either reassign it to an administrator, they can reassign it to a clinical staff, maybe the patient's in a PAC team and it's a specific anti-coag question and it's not within that pharmacist's scope, they can reassign it to that level of expertise, or they can respond on their own. So it really opens up many more ways in which communication can streamline, not only between the veteran, but between pharmacy and the provider.
Excellent. Thanks for that. And there's lots of people chiming in about how much time secure messaging saves them. So your points are definitely being validated. Two last questions. The first is, how are facilities associating their Ask a Pharmacist teams, OE/RR or PAC teams?
I think they're doing both ways, and there's benefits to each. I believe the way we initially were talking about reassignment was using the PCMM panels, and I think though with the ability to use OERR, it allows you more flexibility on reassigning from one triage group to another, because that was a new enhancement that came out not too long ago, where a message to one triage group could be reassigned to another triage group. And I'm not even sure yet if there may be a way in which, if it's not already here, you can reassign a message from a triage group at your local facility to one at a different facility even, which would really benefit some communication with veterans using multiple facilities, requesting remote medications be canceled. We do a lot of that in pharmacy. And so I see a lot of future use for this with that functionality.
Excellent. And one last question before we wrap up here today. How do you envision the typical MyHealthyVet user interacting with the app? There was a question about, what's the benefit of the app versus, using the traditional MyHealthyVet website?
Correct. Well, MyHealthyVet's going through redesign, which is going to be improving a lot of features. But you can ask a lot of the folks in MyHealthyVet, and I work with them directly. The main thing they're trying to reduce is users, especially with the feature that is highly used, which pharmacy on MyHealthyVet is a huge utilization. But a lot of the resources that are medication specific are sort of scattered throughout the site. And this app really utilizes a lot of resources on MyHealthyVet. There's an archive of articles that are contained in MyHealthyVet. Many people don't realize are there, but have been created and added to the site over the years, but you have to search the archive, and you have to just find the archive to find that information. Well, Ask a Pharmacist brings all of those articles back into within a few clicks of opening the app. It also brings all the pharmacy information, VA information, plus MyHealthyVet pharmacy information within a few clicks. And they really count those clicks when they look at utilization of MyHealthyVet, like how many clicks does it take me to get to where I need to be. And so this sort of points them in the right direction. That also allows them to have trusted resources versus going to Google and doing just a free text search for medication information and getting a variety of topics. This is information that VA pharmacists and pharmacy staff and technicians and coordinators have actually provided to the veteran to say, you know, we've looked at the resources and these are the ones we suggest you use because they're using trusted resources that are .gov sites. They're using a National Library of Medicine for a search tool that uses images that the VA actually vetted. We actually help create the images that you're seeing on this app from this external site. So that the main thing is to help take these resources that we have and provide education to a heavily used service and put it into a mobile app so that users can access those quickly and share that information with their caregivers, with their providers outside the VA, so those providers can help them provide better care and just bridge that gap of communication with a secure messaging feature, because that's where you have secure messaging, but how are you promoting it for your service? This app promotes it for your service. This app tells veterans, instead of calling, here's an option to send this secure message and use this form of communication. You may actually enjoy much better than being stuck on hold on listening to the music on a phone all day. I guess in a summary, shop.
Oh, yeah, excellent. So I want to end on a high note here. We're getting a lot of really positive feedback. One of the comments was that the patients Google so much information related to medication that having all this in one the trusted resources in one spot is a win for all. So I think that really summarizes, and thanks Tracy for your comments on that. I think that really summarizes the Ask a Pharmacist app today. I want to thank everyone for sticking with us in the beginning through our technology challenges and for participating today. We are going to end the session now. We're going to follow up with you with any questions we didn't get to, and to the slides, as a reminder, are at the top right of the chat screen on the paper clip. And please fill out the questionnaire link that we'll send to you following the presentation. Let us know how we're doing and any additional topics you'd like to hear about. And just an extra special thanks today to Dr. Spahn and Damien Sharp for your participation. We really appreciate it. And with that, we'll let everyone hopefully get to their weekend. Have a good one. Oh, Damien, go ahead.
This is Damien. Can you go to the next slide, please? The very last slide. And this is I wanted to point out the URL for providing feedback. That's all I wanted to do.
Excellent. Yeah, thank you. We'll send that as an email as well.
Yeah, so just so everybody knows, I'll be sending out an email to everybody who we've captured, and that survey monkey will be going to everybody. So we'll collect that and share the results, Damien, with you and Dr. Spahn.
Thank you. I appreciate it.
Thank you.
Thanks all. Have a good weekend.
Thank you all. Thank you, Dr. Spahn.
Thank you. Bye.